Welcome back to the Fertility Fight Club podcast. I'm Crystal, and I'm so excited you're here today. Today's episode is one I know so many of you have been waiting for because we are answering all the questions you've always wanted to ask your IVF nurse, but maybe were too embarrassed to ask, you forgot to ask, or your nurse just simply didn't have time. So here we go. Joining me today is an amazing nurse, Lindsay. Between the two of us, we've seen thousands of fertility journeys from two very different perspectives. Lindsay inside the fertility clinic and me working alongside clients to optimize their fertility through nutrition, lifestyle supplements, and helping them navigate the often overwhelming world of infertility. Lindsay and I work together very closely, helping all our clients and patients get pregnant as fast as possible. Today, we're pulling back the curtain on IVF. We're talking about all the things nobody tells you before treatment, busting some biggest fertility myths, answering the most common questions, sharing behind the scenes insights from the clinic, and yes, we're having a little fun along the way. Because if IVF teaches you one thing, it's that some of the things we do during treatment sound absolutely crazy, but if we've gone through it, you know it. If you love this episode and you fall in love with Lindsay, you're going to want to see what's coming up. Lindsay and I are going to be going out into the field once a month, answering questions, doing treatments, figuring out what moves the needle on your fertility journey. We're going to be doing all these fun things. We're going to be trying treatments. We're going to be going into the labs to give you an undercover perspective. So many things. So stay tuned. Now let's jump into the episode. Lindsay, welcome to the Fertility Fight Club. Welcome to the Fertility Fight Club. Today we have a really good episode. We have Nurse Lindsay from Victory Reproductive on with us, and we are going to be talking about questions that everybody wants to ask their fertility nurse, but they're too hesitant. So I often get these questions. I filter them through and ask Lindsay, and she's always more than open to share. And we're going to share some funny stories. We're going to share some myths. We're going to do a fact or fiction kind of thing, true or false. We're going to go through a little bit of everything on the journey of IVF solely. So welcome, Lindsay.
Thank you, Crystal. Thank you so much for having me on your show. It's such a great experience and to be part of such a great thing.
I'm so excited. For those of you that many of you may not know, Lindsay and I work super closely together. We talk 7 days a week.
Yeah. While working out,
while eating, while getting ready, while brushing our teeth. And we're just trying to make sure everybody is set for their fertility journeys and make sure they have their meds and their cycles are good. And if we ever see anything off, we're like, does this look right? Or should we switch something? Should we call in Dr. Victory? What should we do? So that's why I wanted her as the first guest. And we'll tell you more about this at the end. However, Lindsay and I will be doing a regular feature once a month. And it's going to be kind of like that try it thing. And we're going to be out in the field doing different fertility things. And then we're going to come back in here into the studio and tell you all about what works, what's a myth, what's a fact, what actually helps and boosts your fertility, from foods that we're going to be trying to NAD plus to all the things. So it's going to be kind of fun. So stay tuned.
Lots of fun.
But today we're just going to be talking about IVF and getting down to some of the questions that people are really too either nervous to say, because they always say to me, oh, I didn't want to ask her because she's going to think I'm really wacky, or the girls will say, I'm too embarrassed to ask the nurse this or that. So, and I'm sure it's not only you, it's across the board. I get asked. So no matter what clinic. Hi, I'm so happy you're here listening to my show, The Fertility Fight Club. I really need your help with something super easy. It's a huge help for you to like and subscribe on your favorite platform so you never miss an episode. It's a small thing, but it helps us reach more women like you who need this community. Thank you so much for being here and supporting the work we're doing. Now, back to the show.
Yeah. There is a lot of patients, I think they are given wrong information, or they have a myth, or they Googled something, so they think they know, but they don't want to check because they don't want to look like they don't know what they're doing.
That's right. Yeah, exactly. And then, you know what? The reason we're also doing this is because our number one rule and the rule of the Fertility Fight Club is never Google. You have to ask Crystal. And if I don't know, I will find the answer. And that's the point of this. So we want to clear up some of those myths today too.
That sounds great.
Yeah. So let's start. The first question, what do you find the biggest mistake they make when they're doing IVF? From thought process to things that they do.
I think the first thing to touch on with that is I think brand new IVF cases, they don't understand the process of IVF. So they come into it thinking, okay, this is great. We're going to have a consult right away, testing, and I'm going to be pregnant in 2 months.
Absolutely.
So I think one of the biggest misunderstanding and mistake is not knowing, like the lacking of education, I guess we could say. So it's a longer process. If you need IVF, some patients don't need IVF. Not all patients need IVF, which is another myth, but the length and time. True. And I get it when it's been so long. Yeah. You want a baby, like you want to have it yesterday. Yeah. But to get it the right way, healthy, everyone's healthy. It takes time.
Yeah, it does. I think another thing people don't understand is you're at the clinic a lot.
Yes. Yes.
You're at the clinic a lot, and there's a lot of waiting for treatments, waiting for the doctor, waiting for your cycle to start. There's so much waiting in it. And people just think if they go to a fertility doctor the next month, they'll do IVF and they'll be pregnant.
Yeah, for sure. Yeah. And it drives in the frustration level from that, which trying to give reassurance. But the biggest thing is that I always tell patients when we rush, errors happen. Those mistakes are made. Yeah. And I hate rushing as much as like you want to speed this up. 100%. I don't want to rush because I don't like mistakes. Yeah. I like to be organized. Things are aligned. And everyone understands. Yeah. And when you're going into something like IVF, like it's such a big commitment that I want patients to like give consent and know what they're getting into. Exactly. So otherwise I'm doing procedures and setting things up where they don't really understand. I feel like that's not right. No. They need to go in knowing everything.
Yeah. Yeah. I see that a lot. For me, a lot of times if they're working with me one-on-one, I make them join for 4 months minimum. And they're like, well, what if I get pregnant next month? And I'm like, gosh, I hope so. And it does happen a lot. Yeah. But I need you for 4 months because I need to make sure you're a healthy mom. And even if we haven't even started IVF maybe in 4 months, but we're getting your body healthy and we're getting your partner's sperm healthy and we're doing all the things. And those things are so important. And making sure you have the right doctor and the right clinic and the right medical team, right?
For sure. Like there's a whole approach to it, like work on your healthy lifestyle, like your environment, your lifestyle,
all those things.
Then we have the genetic component, but we want to work at everything to have the best outcome.
Yes. And that's what gets you the results fastest.
Exactly.
Yeah. So that's one of the myths. Another one, like when they're in the process, I guess a big one, and I'm sure you hear it too. They always think that it will happen the first cycle. They do IVF and they'll get pregnant. And we know it can happen. It's not wrong, but it's very rare that it happens.
For sure. And I get that asked a lot. Like, what are the chances? Like, is it 100%? Yeah. What are my percentage? Like, what are the chances? And I tell everybody there are so many variables to every single case. Everyone. So even if I'm going through this and I'm asking you, Crystal, like, well, you got pregnant right away, so it's got to happen for me. But I don't know what your medical history is. Everybody, no one's going to disclose every bit of information. Exactly. So we're all our own. We're all individualized. Exactly. So there's a lot of variables. So we're going to work with everything in your case to give you the best chance for success. Exactly. But even then, nothing is ever 100%.
Never.
So, but we work to do our best, just to give you the best outcome.
Exactly. What about, I get told this a lot. They've been probably at a different clinic before they come to me often. And they'll say, oh, well, I was told I have like a ton of eggs, so IVF should work right away. And I'm always telling them a lot of eggs doesn't guarantee IVF success right away. It is obviously a good advantage, but that is a
absolutely
myth. Yeah.
Just because you have a lot of eggs, it's great and more for us to work with. Yeah. But it doesn't mean the quality's there.
That's right.
We could have tons of eggs, poor quality. Yeah. We could have less eggs, better quality.
Yeah.
It's in everyone's genetics, but that's why we do all the testing to know kind of what we're walking into.
That's right. Yeah. What are some, not really myths, but like things that come up that people just like totally underestimate that power?
I think your approach with healthy lifestyle. I don't think people realize how much of their lifestyle can affect egg quality, sperm quality, overall outcome, even pregnancy. Smoking, drinking.
Yeah. Marijuana.
Yep. That's a big one. Your diet, certain foods can increase inflammation. So working towards that. And I think those are some of the things that just get kind of pushed aside. They they just think medication's going to work. That's going to be the all. There's lots of people go and they think just that magic pill, please.
Oh my gosh, that was me. That was me. My first round of IUI and IVF. I just thought, of course it's going to work. My doctor had her big certificates there. Of course, I don't have to worry about anything. So yeah, a lot of my people come in with that aspect too. Yeah, for sure.
For sure. And that's why you have your great meal plan. And supplement. It's wonderful. I'm just go see Krista.
Well, that's why I noticed the biggest change in people overall, because I was already doing fertility coaching. And then I seen the biggest gap was when they changed their diet and worked on lifestyle. That's when things happen. So I always find like nutrition is the biggest thing that will move the needle the fastest.
For sure.
If they commit.
Yep.
Yeah.
Stress. Yeah. That's a huge part of it too.
Yeah.
You need support. A good support system is a big one as well. Like I've had patients where they focus on health, and then it's almost like you become hyper focused on fertility, and that's all you're thinking about. And your partner's almost kind of, you're detaching a little bit because you're so focused on,
so laser focused.
Basically call it like timed intercourse. And then there's no fun left in it.
There's no fun.
So the partner is like, that's not fun for him all the time.
No.
So
it's true.
That's one thing. And then sometimes I'll get some patients where they're just like, I just need a little break. And I'm like, yes, go on vacation. And it's surprising how many will get pregnant on their own when they just bring the fun back and take the stress out
and relax. Yeah. I've had couples that the doctors will say have intercourse every day or every other day, because that's you'll know, maybe that could be one of our fun questions later on. But for me, I get, if as soon as I ask the couple, like, how often do you have sex or intercourse during the month, they'll say, oh, like once or twice during ovulation. And a lot of them don't know when their ovulation is. And that's, I think we've talked a lot about this. That's the fault of our educational system, because we just as women aren't taught about our bodies or cycles.
I do feel the education system failed us through school. I don't even think, I'm trying to remember back to like health class.
I don't remember
I don't remember them saying maybe a bit about ovulation. Basically just, I don't think you have ovaries and they release an egg, but and then along that, I'll get patients that come in and are like, well, no, my app says this, so I'm an ovulate.
Yeah.
And I'm like, I'm looking on the ultrasound and you got nothing going on.
Yeah, that's the problem.
But it's just an app. It's I feel like it's not you. Blood work and ultrasound.
The blood work and ultrasound is what we need.
Yes, exactly.
Sure.
So that's one thing that's
one thing
when they use their apps, and it's like, don't go by that.
No,
don't go by that.
And then to bring that back to the intercourse level, I'll suggest like every other day, and then they panic, or the doctor will say like every day or every other day. And that's when I've had couples come to me and they'll be like, Crystal, we've never had a fight, and now we're fighting about having sex because it's exhausting and it's now become a job.
It is. And that's where like the fun's taken out of it. Because if you're so focused on, no, we're just intercourse right now, like just because we're trying to get pregnant, and the rest of the time it's just that sperm's just sitting there.
Yeah.
Not doing anything, kind of going crappy.
Yeah. Exactly.
They have to have frequent ejaculation. Yeah. Clear out all the duds, get some nice fresh new sperm. And then it keeps them connected.
Yes.
Not always so focused.
Yeah. So just like, it's hard. It's hard to let go. And a lot of my clients, I feel like a lot of fertility patients are so type A that they have everything organized so perfectly and so timed. And this is the one thing they can't control. And this happened to me, including me, that you can't control it, and you just want so badly to control it. So you want to be able to map it out, and it doesn't work like that.
And that is very hard, especially you're type A, that when they come on and they do want to control everything and set things, and it's not going to work that way.
It doesn't.
It's same for like your cycle. When we're medicating you, there's people are so focused on, they're like, well, no, I'm supposed to ovulate here, so like it's not going to work. They're forgetting that we're controlling your cycle with medication. We have all the control. We're going to tell you when we're going to release those eggs.
We get those questions often. Yeah. I think that would probably be one of your biggest ones, right? Your biggest questions you get daily.
Yeah, I do get quite a bit of that. They're worried about their flow in relation to their IVF cycle, and trying to explain like everything is all hormone based. Yeah. So we go on hormones and follicle sizes. And if you have spotting in there, that's okay.
That's and they panic when that happens.
They do. Yeah. Spotting sets off panic.
Yeah, of course. Yeah. It really does. Yeah. So those are some of the big ones. And then we have the opposite of our type A's that for me, I get this probably a couple calls a month that they've forgot to take their progesterone, they've forgotten to take their medication that night, or they need to do it like 5 hours early or the next day or whatever it might be. And they don't understand the importance of timing.
Yes.
And
yes. All the medications, if I see one big error that happens in cycles is forgetting to take a med, not picking up your medications from the pharmacy,
medication.
knowing, because we try and go through like an IVF cycle, you're on stim for, we'll say 10 to 12 days on average.
Yeah.
And then I always say, set out your meds, look out to see what you have, and you got to watch when you need refills.
Yeah.
Taking them consistently. They're short acting. So it starts to wear off. So that's the way we say, stick to a time, be consistent with it.
Yeah.
And then the trigger shot, we are very specific with that. That is the most important. And I'll get so many calls where I had a trigger shot
for those that don't know. So just in case there's anybody watching that hasn't gone through it.
Lindsay, so the trigger shot with Victory Reproductive Care, Dr. Victory, we do a double trigger, and that is decapeptyl and HCG.
And what is that doing for them? Why is that important?
That is going to start the release of the eggs so that Dr. Victory can go and retrieve them easier.
Snag them.
Yes. Yeah. Because it gets hard to get them. Like they don't want to release it. So that helps to basically start the process. Yeah. So it's timed. We do 36-hour trigger. Yeah. So it's just the right timing that we can go in and
grab them,
suck those out.
So if they do it late or early, what happens?
They do it too early, they could release. Too late, it's tricky for us to get out. And then we can't, we try it. We'll try everything we can to get the eggs. We'll flush the follicle. But sometimes we can't get them.
Yeah. Mm-hmm. So that's really important. And I see it, and I think because it gets so overwhelming, that's where I think you kind of forget because people zone out or whatever, and we have lives and we have careers, most of us.
It's definitely overwhelming for sure. And I get that patients say that quite often, and you can see the panic. You can feel their stress. Yeah. And I try to like bring them right back down and let's say, okay, we have to focus we take it one day at a time. Yeah. So right now we're just going to focus on, waiting for your cycle day 1. We reviewed your meds, so tuck everything away, and then you wait for my email. Yes. And you pull out what you need. We're not going to talk about embryo transfer right now.
No.
We're going to talk about first your meds, and then your next appointment, and then we're going to talk about retrieval. And I find it kind of grounds them a little better because when you start mapping out the whole process, it does get to be overwhelming, and we all know it never lines up that way.
No.
Your period will be late because you're stressing, and then it screws up your calendar.
Yeah.
And that gives more stress. So we can't control. This is stuff we cannot control.
No.
And if you let go of that need to control it, I find it's
a lot easier.
Yes. Yeah. And that stress is not good for your body and eggs and sperm.
And that's one thing I will get told or said, my retrieval is going to be on whatever day, like Saturday. I'm like, oh, did you get an email already? And I'm like, wait, how is this happening already? It's like 2 weeks before.
Yes. I do get a lot of emails.
They know. They're like, well, technically it should be. And I said,
I'm supposed to ovulate.
Know. Yeah.
All the time. There's like, when's my retrieval? Can we book it? I'd like this time.
Yeah.
That's great. I can't do that.
Yeah. And we don't pick the times.
Nope. No. We always have to do them in the morning because it is under conscious sedation.
Yeah.
So nothing to eat or drink overnight.
Yeah.
Not even water. I'm going to put that out there.
Ooh,
yes. People think they can still drink water.
Okay.
Anything in your stomach. What it is that if you were to vomit when you're in sedation, you can aspirate the contents of your stomach into your lungs, which it can be fatal in some cases. So that's why we don't want anything in your stomach. No water.
Okay. That's good to know.
Yes, we have had to delay retrievals for 6-8 hours into the evening when somebody came in and decided to eat breakfast before they came in. And there's not much we can do and hope that there is some eggs there left.
Yeah, I know. And I've seen that too much. Yeah, exactly.
I know.
So I think how we work together well is we try to reduce a lot of the stress. Mm-hmm. And we're not going to eliminate everybody's stress or even the stress around this journey for sure. But I always say it's you're never going to get pregnant if you're in that running mode because your body's I need to get to safety.
Let us stress over it. Let us figure it all out so that you can sit back. And I think that's why I think we work so well together. Yeah. We're a team and we have to share the common goal.
Exactly. And our goal is to get you pregnant really fast.
Exactly.
Yeah, absolutely. Exactly. I have I think it was called, I named it true or false questions, but some we might have to go into a little bit deeper if that's okay.
Sure.
Okay. True or false? Bed rest after an embryo transfer improves success rates.
False.
Yes.
False.
Yeah.
Regular activity is important.
Yeah.
We do advise don't lift anything over 15 pounds, no heavy bending, twisting. So I would say scratch out the yoga for a little while.
Yes. Twisting.
Don't try and crush any goals in that 2-week period, but be normal. Walking, being active is still very important.
Yeah.
Because it promotes blood flow, and that's what we want. We want blood flow down to the uterus to get that embryo to stick in there.
Yeah. That's what I'm always saying. No twisting. So no yoga.
I have heard some funny ones, eating pineapple or McDonald's French fries after
McDonald's French fries.
I haven't seen a study, but if someone were to say, eat your pineapple and have French fries, I'd be like, okay.
Yes. Yes.
You're not going to not do it if you think it might give you a chance. Mind over matter.
I would pick some good French fries, but I know that the superstition is McDonald's French fries.
Yes.
And
I'm honestly not sure where it came from.
It was a doctor, I believe, in the US that told one of their patients to say, go eat. She said, what can I do now? And I guess the doctor said, go have some McDonald's French fries.
Yeah.
Because the sodium will like puff everything up and make you whatever, and your uterus is more receptive or whatever. And that's what kind of happens.
I've just been rolling with it because I'm like, well.
And the pineapple, the bromelain, helps reduce inflammation. So the pineapple is true. I give the girls pineapple core.
Yes, that is part of your anti-inflammatory diet.
So that works too, we think. But it's a whole bunch of things like warm foods. I always say like vitamin C, so eat like a whole bunch of like yellow and reds and orange foods during that time.
It's everybody. I always get that asked. What else can I be doing to help?
Yeah.
And I would say maintain healthy lifestyle.
Yeah. Walking.
Maintain healthy lifestyle. That's the key, because we're rolling it into a pregnancy, and
healthy.
If you're healthy, like eating healthy, exercising, we all know you feel better. Like I feel like $1 million when I'm when I'm on the wagon still.
Yeah, exactly. Exactly.
You want that in pregnancy.
Yeah.
Because you'll feel better during a pregnancy.
And you have to keep like moving. So I'm like never, and I think they used to like years ago tell people bed rest after a transfer. So I think that's why
it has for
most doctors have switched over and they say, no, you can like move around and stuff. I always say, make sure you're walking, like get up every once in a while and walk and see how you feel. Right.
And we can always go back to the questions that people are afraid to, or they start Googling. If I sneeze, will it dislodge the embryo?
Follow?
Yes. If I cough too hard, is it going to fall out? Am I going to undo?
Exactly.
And I get the stress. Everybody's wondering, because
absolutely.
If I wasn't in healthcare, I'd probably be wondering the same thing.
Absolutely.
But no, it is not.
It won't fall out.
No. Actually, it was a long time ago that somebody explained like your uterus, and this is like where our healthcare system kind of failed us. Everybody, I think, thinks our uterus is like a hollow, like pear shaped, like just a hollow organ in there. And it's not. It's like two pieces of meat stuck together, it's that embryo stuck in there. It's not going anywhere.
It's like Velcro. Yeah,
exactly.
Yeah,
but the analogy, but it's like, you're right. I think I used to, long before I took anatomy and physiology, I thought it was
just this
a hollow
circle thing. Yeah, exactly.
It is not hollow.
And they don't realize how small it is. Like it's like smaller than your fist, right?
Yeah. Yes. And your ovaries very small.
Yeah, the ovaries are so small too. Yeah, we don't see that.
We should have a health class.
Yeah, yes.
That's some diagrams.
Exactly. Yeah, exactly. Well, I think we discussed this a little bit. More eggs always means a better IVF cycle.
Not always.
Not always.
No. More eggs is a higher AMH, which you could typically fall into your PCOS, which have a history of poor egg quality. Yeah. It's not to say that all of them are bad, but it doesn't mean just because you have more doesn't mean they're better.
Yeah. And we see that. And like we're in Canada, so I know there's a lot of like US, Canada listening kind of thing. But in the US, they stim them hard. So a lot of the girls will have like 40, 50 eggs retrieved each cycle. Yeah. And in Canada, we just don't do that. Well,
no, it's not necessary. The higher doses of meds can actually fry the eggs, and we don't want that.
Absolutely.
It's just
the over medication.
You don't want to drag out a stim too long. You don't want it to be too quick. Yeah, it's just finding that balance to get your better quality. And in the end, we want better quality eggs that will grow to embryo. Exactly.
Yeah, exactly. That's true. So I see the girls again. No Googling, no Facebook groups. That's the death of everything. However, they'll see on the Facebook groups, the American girls will have 40, 50, 60 eggs. And I'm like, they probably have the same results, 1 or 2 embryos, maybe 5 or 6 embryos that are great.
Definitely,
really
yeah.
varies.
No Googling.
Yeah.
I should write that in my automatic reply.
Yes, no
to patients. There is a lot of false information out there that's
Absolutely.
not backed by any evidence-based practice. It's not factual.
No.
Facebook is not a source of
No.
your education.
And what works for one girl, as we said, won't work for another.
And that's where nobody knows their whole health history to the close. So you're just hearing some of the outcome, but you're not getting the whole backstory.
Yeah.
And that's important for you to realize, oh, okay, that makes sense. Why it's that, why I'm this. And like I said, none of us, we're not the same. There is no two same individual.
Yeah, no, for sure. There's so much comparison, right?
Yeah. And and it's natural. I feel like we do compare.
We do it in life. Yeah.
Of course.
Like,
I like your hair and I'm wondering how do I get that?
Exactly. True or false? A poor embryo quality can never become a healthy baby.
False.
Exactly.
Yes.
People worry about that grading number far too much.
They do. And I do feel really bad because you can just see it, their whole, like everything just almost, they feel like they look like they shattered.
Yeah.
And there's one case right in mind. It was their very last embryo. So, and we transfer, of course, like we have them all graded top to bottom. It was the very last one and you're not going to abandon your embryo. So she was ready to do another round of IVF and it took. Yeah. And then she got pregnant naturally after. So she actually just delivered her second
those
on her own.
The stories I liked. Absolutely.
I know. And I have another case, same thing. They went through and it's like they're in their mind. It's like, well, the embryos, it's no good.
And I think
it's not good.
They're relaxed then because they kind of have like, it's not going to work anyway. And we're going to do IVF. So we may as well just transfer and try. So we're not leaving it there. Yeah. Because the guilt of leaving an embryo hits everybody hard.
For sure.
And they tried and it works because maybe it's the stress.
I 100% agree. Like I said, let it all go.
Yeah.
Let us look after your cycle. Let us kind of worry about those things. We'll just tell you when to take your meds. Yeah. Go through.
Because I see this too. And I'm not on a lot of the Facebook groups, but sometimes I'll be like aimlessly scrolling to like brain drain. And I'll see, oh, I have like a 4AB who's had healthy pregnancies with this grade, or I have a 2BC who's had a healthy, but there's so many other variables. Why are you asking this question? It's going to drive you more crazy.
And that Googling of, I did this. Is it gonna ruin?
Yeah.
Is it something bad?
Yeah.
Like just that constant Googling. It's just like, don't go down that rabbit hole. You have to, and I guess that spins into, you have to trust your healthcare provider. Yeah. If you don't trust your team,
move.
It's not good. Don't stay.
Yeah. Don't
100%. Because if you don't trust and you're questioning everything, then it's, what's the point? Like, let us do that. Let us look over everything. And you also want to find a good clinic and physician that is like up to speed, basically, with all the new technologies. And fertility has evolved so much over the past 20 years.
20 years and like 5 years and 2 years.
Yeah.
Like
there's just new technology. So it's, you got to roll with it or.
Yeah. And I do, sometimes I'll say like, somebody will come to me and tell me their situation. I'm like, I don't think your doctor has actually read a medical book in like 50 years. So let's get a second opinion.
That's true. Actually, I heard something on the radio. I think it was honestly this week. And the radio show, they were talking about fertility. What? And they were saying how fertility, like infertility has increased significantly over the past 20 years. Especially, I think it was 20 years. But they're like, well, what happened 20 years ago? Yeah. And they said the iPhone came out. Yeah. And I'm like, oh, cheapers. That's not going to be good for
the
Apple.
guys have it in their pockets.
But do you remember growing up when the girls would stick it
in their bra?
Yes. And they were saying, is that linked to cancer? Yeah. Like, I don't think there's any. Who knows? But it was kind of funny that I'm like, oh, yeah, the iPhone.
Yeah. Well, guys, I will tell you on my sperm protocol, get your phones and laptops out of your pants and off your lap because it's heating up your testicles and frying your sperm.
Yeah. And now you hear about the plastic too.
And the plastic
and things. Yeah. It's things that you don't even realize, but it's like, it is. But what is the reason why infertility is increased? Like there's something.
So many things. I think
we are more unhealthy for sure.
We're more unhealthy. We're so much busier.
Yeah.
Everything's rush. The iPhone is one thing because we're glued to it. Yeah. So we're like less active. Yes. Everything's like, we're not having actual, like a lot of, like they say for longevity, one of the big things is connection. But we're not connecting anymore because we're
No.
too busy on like living everybody else's lives on Instagram.
Very true.
Right. So
Yes.
I think it adds, and then the food we eat and the food quality we get, like,
Yeah.
right. So there's so many things.
I know that's a whole rabbit hole in itself.
We all go down more rabbit holes, as you know. Okay, let's see. What else do we have? Younger women don't need to worry about egg quality. And I'm saying like under 30.
I think everybody needs to consider egg quality. And this will kind of go along with, we don't know your genetics. We don't know when you're going to go into menopause. We don't know any of that until we get your AMH. And as your AMH does go down, the quality is going to get down. So that's a hard one.
I know.
I still, if I had an option to say, it's when I was back in my 20s, we'll say, do you want to improve any of your quality or just go as is?
Yeah.
Well, I want to improve. If there's room for improvement,
you want to improve.
Why wouldn't I with anything?
Yeah.
So if there's always a room to improve quality, I would say yes.
Yeah, I know. It's just one of the things I get. A lot of people will come to me first and say, my family doctor won't even give me a referral to a fertility clinic. And we've been trying like over a year, but we're 24 and they say I'm too young. So I have lots of time. And that's heartbreaking because
I agree.
A lot of times some quick questions and it's the girl screaming like, oh my God, this girl has endo. She probably needs surgery or an endo protocol. Or like clearly PCOS, but nothing's addressed, right?
I know. And then even just that mentality when they say, well, you're only 24. Well,
yeah, but who's to say she can't have kids at that age? Exactly. I see it.
That's not, that's not right for sure. Like that's not my decision. Like,
and a lot of times that the younger ones, if they've been struggling for whatever reason, genetics or whatever, their AMH is like crashed and their DOR, diminished ovarian reserve. Yeah. And it's heartbreaking because they're 26.
It is. And if they're on the down, heaven forbid, if their genetics they're set to hit menopause by 30 and they're struggling at 24 and the doctor brushes them off, if they keep trying to come to us at 31 and it's just like, oh my goodness.
That is so frustrating.
Exactly. I feel like if a patient comes to you asking for help, who are you to say no? Like, send them off. That's why we have specialists. Let the specialist review and decide.
And like at least get it checked, right?
Absolutely.
Yeah. That breaks my heart. And I see it all the time.
Yep.
And they're so young and they're like, all I've wanted to do is be a mom. And now I can't, that happens at every age. Yeah. But when they get dismissed by their family doctor, so they're trying to find other support. Every age. Yeah. You're 40 coming in and they wanted to dismiss you. Exactly. Because of that age. And it's like, who are you to say? And we have a lot. I think we were talking the other week. I have so many calls now that everybody's over 40. Yeah. I do. We get a big grouping of that age. And then we get a grouping of like your late 20s. There's that split. And they're the heartbreaking cases, both of those sides of it. I know. Yeah. It is for sure. But yeah. So in that case, we battle it out and we get them a baby. we always develop a plan. Like it's exactly. The thing is, you want to develop a plan specialized to each individual because my plan that works for me might not work for you, might not work for the next one, but you have to tweak it. And that's where, even like we talked about, like you need to trust your clinic, go to a clinic you trust. Patients will come to me and they're like, well, I just had testing done at whichever clinic. And I always say, I can't make you, but fresh new clinic, fresh new eyes, fresh new testing. Absolutely. Because everybody I'm sure their clinic was like, I won't never speak poorly of any other clinic. No, but what if they happen to miss something? Exactly. So, and we have an opportunity to pick something up that was missed as to could be the reason why you didn't get pregnant. You're listening to the Fertility Fight Club podcast. And while I hope every episode gives you new information, better questions to ask, and a little more hope, I also know that sometimes a podcast just isn't enough. Maybe you're overwhelmed by all the advice. Maybe you don't know what to focus on first. Or maybe you're tired of being told everything looks normal when you know something is being missed. That's where the Fertility Fight Club community comes in. Inside the community, you're not only just listening to me, you're working with me. You get live coaching, support calls, expert conversations, fertility education, practical resources, fertility-friendly meal plans, and a community of women who genuinely understand what this journey's like. I help you cut through the noise, recognize the red flags, ask better questions, and focus on what actually moves the needle forward on your fertility journey. So, if you're ready for more than just information and you want real support and a plan, come join us inside the Fight Club because your journey is hard enough. You shouldn't have to be fighting alone.
And that comes also down to the rushing, like they
Yes.
want it right away. Like, I've got
'Cause they
everything. I
have
want to
the
proceed,
testing.
but it's just like,
Yeah.
just give us, just let us
Yeah.
repeat just a couple little things. Like, quick, we can do it so quick. We don't have to do the
We can.
full everything. Just a little bit.
Yeah, and that they want to do it fast. Yeah, I know. That's a hard one.
It
Yeah.
is so hard because everybody
Yeah.
has a story, and you feel bad.
Yeah.
But in my mind, I'm just like, I
But-
just want the best outcome for you.
Absolutely. And there's so many times I've seen with so many clinics that how they do, say, the sperm testing, the metrics and the things aren't even what we're looking for, or what actually, like, their markers are set way different. That
Yep.
I know if I look at it, well, that's actually considered poor sperm and
Yep.
not Superman sperm, like some of the doctors will call it.
Yep.
Or they have never done a DNA fragmentation test. And there's very obvious things that maybe the DNA frag is high.
Of course.
And we know that compromises the embryos and stuff.
For sure.
And they just don't want to do it, or it's never been suggested, right? So that's kind of frustrating.
And that could be also your younger couples. They come in and it's just like, oh, you probably don't. Like, you don't need to. You don't need to do that.
Yeah.
When maybe she's great, but
maybe what's he doing?
Exactly.
Yeah.
So it's just check it off, because I would always be wondering, what if?
What if? Yeah.
I don't like those what ifs.
And I don't know if you guys run across it a lot. Probably. I have had a lot of clients that it was crazy. I hope she's listening. Anyways, they had done, I think it was like 4 rounds at 2 different clinics of IVF. No success. And I looked at their stim sheets, and I always say I'm an investigator because I look at all their blood work, and I am not a doctor, but I look at everything and I'm like, wait, this doesn't make sense. And why are the embryos all failing on day 3? What's going on here?
Yeah.
And then nothing, like, she said, oh, we never did the defrag. And I'm like, okay, but they were told Superman sperm. Then I start asking them more questions, and they said, yeah, they couldn't figure out why the sperm was not perfect, but they never did the DNA frag. I'm like, okay, ask more questions. We realized that he was on, I can't remember the medication, but it's for hair loss for men.
Oh, Rogan?
Yes.
Rogan?
And I think that's
Rogan?
what it is. Yeah. Kills the sperm. Like nothing. They went off it for 2 months, and they now have 2, because she just texted me pictures, 2 healthy babies, no IVF needed. That's all it was. The doctor didn't even ask. Yeah.
Interesting.
Yeah. But it's those little things that they don't take into account. Like, but they'll ask the woman what medication she's on.
Yeah. Anytime a cycle, based on everyone, like all the results, I can kind of predict. I can always predict kind of how it's going to go.
Yeah.
Like how many embryos we should get.
Yeah.
But when a cycle, goes south, and it's like, okay, but instantly right then, that's when review it with the doctor. And it's like, okay, what are we missing? There's something, because this is not an outcome that we want. And that's instantly a time that you got to try and tweak things.
Go everything.
Don't just go and repeat it. Just like with embryo transfers, just sit there and just keep transferring.
Doing
it's
the
just
same
like,
thing over and over.
Okay, halt. Let's take a look.
Let's see what's
because
going
there's
on.
something else.
Yeah.
When you have good quality embryos, no history of recurrent pregnancy loss, something's not right.
Something's going on. Yeah.
So that's your cue.
Especially when they've never gotten pregnant before.
Yeah.
There's definitely something going on with that uterus, right?
Look at the whole picture.
Yeah.
So 100% we won't sit and just transfer. And that's one of the biggest things I know Dr. Victory will talk about. They just sit and keep transferring. Make more embryos, just keep transferring.
Yeah. Or we'll just do another cycle.
Yes.
And I think that's what a lot of clinics are missing. They're just like, oh, we'll just do another cycle. Well, in Ontario, we get like 1 government funded cycle. It doesn't cover nearly everything.
No, it covers a good portion.
We're grateful for that.
Yeah.
However, it doesn't cover everything. And like we said at the beginning, most people need more than 1 cycle. The issue then becomes, though, some of the doctors just like, oh, we'll do another cycle. We'll do another cycle.
Yes.
And the people are financially tapped out. And they're like, how do I do this?
That's one thing that I look back to, and I will go through that with patients to sit when we're trying to map out, when we know how to do IVF.
Yeah.
Then I review everything with them, because I'm like, it is expensive. Like,
it's huge.
There's no way around it. And I'm not going to beat around the bush. Like, I'm an advocate for my patients.
Yeah.
And kind of go through that, all these cycles, and what you're going to look at for money with medications, traveling to appointments if you have to miss work, all of that sort of thing. And then I'll even touch on using an egg donor, because sometimes I hate when patients come and they're like, I wasn't even told about an egg donor, and I've done
option.
5 rounds of IVF, and I'm like,
Yes,
you just spent more than if you had
you
just
got
used a
the
donor. So
yeah.
I look at everything, and 100% like you do not have to proceed with an egg donor,
No.
but it's nice knowing the cost,
The
everything
cost
associated,
difference.
so that
Yeah.
there's no surprises, and those are the
And they'll
surprises that we
know.
don't want.
Yeah, and they'll know if their egg quality is really poor.
Yeah, we give
They
all
can
of
weigh
them.
that out.
Yeah.
And the goal's the baby. So if you need a donor,
Yep.
just jump to the donor
Yeah,
if you think.
you want your clinic should be, your healthcare team should be transparent with you.
Yeah.
There should be nothing hidden. We should never hear, oh, I was never told that.
Yeah.
You want to be,
But
you have to be, we all have to advocate for each other.
That's probably one of our most common things we get told. You and I both every day, probably 10 times. I was never told that. Right? I think that's, we should do a stamp every time we.
Yes. Let's make a list of everything. I wasn't told that. So we're just going to go through. Okay, we're going to tell everybody this so we can't hear. I was not told that.
Yeah. Yeah. Okay. Well, we've been discussing some of these as we're going. So one was low AMH means IVF won't work. And that's not true. No. Sometimes we get really good cycles from low AMH.
Yeah, we can have, your AMH is a predictor of your egg reserve. So we're born with a set amount of eggs that we're going to have in a lifetime. We cannot, that's one thing, we cannot make more eggs.
No.
We can try and improve the quality, but we cannot make more eggs.
Yes.
Maybe down the road, maybe, who knows? Science,
who knows? I know. I feel like it could
but
be
we
there,
cannot.
But yeah.
So, and we don't know how fast somebody's going to deplete their eggs.
That's
we
right.
don't know. So that's why we do monitor your AMH levels. So when patients say, well, I just had it done last year. And it's like, well, we should repeat it because we correlate your AMH with your follicle count. Absolutely. They should kind of go hand in hand.
Yeah, those should. And we should match that. Like, I want to just put that out there as well. A lot of people look at their AMH number, but sometimes, not a lot, but sometimes the AFC won't even, something's off, right?
Yeah.
Something's definitely off. So we got to match. It's not just
for
one
sure.
number.
Something's not right. Other than, your count's not right.
Yeah.
Or your blood work's not right.
Yeah.
So we want to look at that whole picture. But as your number goes down, we're going to work at quality. It just means you will need more rounds of IVF because we're not going to get, say, 10 embryos per cycle. We might get 3 or 5.
Yeah.
And to have the desired amount of kids that you want to have, you're going to have to bank more. And then if you test your embryos, so
now we're down to the 2.
Yeah. We'll just like kind of run through some numbers here. Okay. So say great IVF cycle, we retrieve 20 eggs.
20
okay.
Eggs. Yeah.
It's great if we get 15 to fertilize because not all the eggs are going to be mature.
Yeah.
The sperm is not all the sperm is going to be good enough to fertilize. So, and this is normal. Let's do that. Okay. So we're just throwing out numbers here. This is where Dr. Victory could probably give like
his
better
embryo math.
Yeah. His embryo math. Yeah, exactly. So let's say 15 fertilizes. That's great. That's great. Out of that, let's say we get 10 embryos. That's great. 10 quality, 10 graded embryos. Obviously they're not all going to be perfect. Really yeah. If we PGT test those, we may only get half. 5? That's normal.
Yeah.
And it depends. It really depends.
And it depends on age.
Yeah. As you get older, unfortunately, your normal to abnormal ratio doesn't go in our favor.
That's right. Yeah.
So if you start, then everything kind of depletes down.
Yeah.
And if you tell me, I want to have 5 children.
I know.
5 normal embryos probably won't because not every embryo transfer, it's not 100%. No. We could have everything perfect and it doesn't line up. Yes. Yeah. I think I have heard Dr. Victory say for one live birth, we should try and aim for 2 to 3 normal embryos.
Yeah, absolutely.
So in that math, it's like, well, we need to get a lot more. We got to get more. Yeah. So it's just the breakdown. And especially when the AMH goes down, if we only retrieve 5 eggs.
Exactly.
And we get 3 to 4 fertilized, again, that's good based on what we have. Yeah. But it just keeps going down. So,
and then
we need multiple rounds to bank up.
Absolutely.
And that's part of like the talks that we have is where we want to know that your whole goal, we want to know your goals. We want to go everything.
Do you know how many people will come and say to me, one of my first questions is, how many kids do you want? Because that will determine if they
it's going to change our plan.
Child, then we can do a lot of things provided structurally and everything's going well. Probably could do it naturally IUI with adjustments in diet, lifestyle, medications, things like that.
Yep.
But if they say they want 3 kids and they're 35, well, I'm like, sorry, I'm not an IVF pusher, but I think you need IVF because we need to bank those embryos now. Yep. Right.
And that's, going through as well is talking about, okay, you're 35 now. That's great.
Yeah.
But then when you want to come back, if you want to space your kids out, you're that much older.
Exactly. And
so
now
at least
you're
if you create your
37,
embryos,
38,
those
and
are
now you're
35-year-old embryos.
Exactly.
It's kind of funny when you think about it. You're just
Exactly.
going to pull one
It's
from
so
that
cool.
same batch. It's like, oh my goodness. When you start thinking about it.
But other clinics do not ask the girls that or the couple that.
That should just be your basic assessment, just your, I call it like my welcome calls with my patients, just your meet and greet. I want to know your history because it's going to gear what I'm going to do for you.
Exactly. Yeah. And some people have different things, like they don't want like hard dose medications or scared of the hormones and just like a whole thing. So then we make a plan around what they need and want.
Exactly. Yeah.
Right?
We would never, I tell patients this all the time, like I will never make you, doctors will never make you do anything you don't want to do. We'll give you, we can map out a whole plan.
Yeah.
And then let's tweak it to meet what you're looking for. Because like I said, financial thing is a huge thing behind it. So let's work with that.
Yeah.
How many kids, everything. Like
Everything.
There's so much.
There's a lot to it. Yeah. And people, they get overwhelmed. One thing I do, a lot of times you will need injections. That's a scary thing with IVF. Yes. For me too, I panicked. Let me tell you, I panicked with the injections. You get over it, and I try to walk through it.
I feel like you get over it real fast.
You do. A lot of the girls still don't do it themselves, but I will say that Lindsay's been on FaceTime with me and clients at like 9:30 at night, walking them through their injections.
Yeah. It is stressful for sure.
It is, yeah.
But with it, I find you get in the routine of it, and it just becomes natural.
Yeah,
that fear goes away.
Oh, yeah.
Same with when they come in for blood work and ultrasound. Oh, get a needle, have blood work. That some of them nurse, and by the end,
passed out. And now I'm like, I donate blood now.
I really laugh when patients come in for ultrasound, and we do transvaginal ultrasound all the time. And they're first they're kind of like a little nervous, kind of coming in. And they have the gown over. By the end of all their appointments, they're walking in half the time, just holding the blanket and just trotting it, and it's just like,
oh yeah.
They're just. That's how we roll in here.
That's so true. I used to hate routine. Blood work. Now I donate blood. I just,
you face that fear.
Yeah.
And you get through it.
Yeah. The injections are part of IVF. But I think a lot of times when people think IVF, they think injections, right?
Yeah.
And it is scary. A lot of people are freaked out with needles. And it's one
for
of
sure.
those.
And that's,
and tips and tricks.
And we'll work through.
We usually get through it.
Yes. Yes.
Yeah. Okay. This is a big one. Marijuana will ruin my IVF. True or false?
True. 1,000%.
Yes.
Marijuana, trying to talk about it's I still find it very odd that it's legal. Like, well, it's not. It has its purpose, but still, when I grew up, it was illegal. So to me, I'm like, ooh.
This is your brain on drugs. Do you remember those commercials?
Yes. And it, depending on what you take it for, obviously the THC, the CBD, there's all different variations, but it makes the purpose is to relax you and mellow you out. I don't want relaxed sperm. I want sperm that can win a marathon and is going to go straight to the finish line. Yes. Yeah. That is a big one.
Yeah.
And we
pick it
that
does
up for
destroy.
Sure.
I don't know if it destroys, maybe it doesn't destroy the sperm more, but we can test the sperm. Like I can test your guy's sperm like every week if we wanted. And we can see the progression on when you've stopped marijuana or drinking or smoking or whatever habits and vices you do.
Definitely.
With our eggs, we're not going to do a retrieval every week, right?
No.
So for the guys, I really see a big difference. Like usually we don't test weekly, but we'll test every month.
Once a month we do that.
We can really see the progression if they've stopped drinking alcohol or marijuana or cigarettes.
Yeah.
Those are the 3 big ones for guys. And it's the fastest improvement.
Yep.
Right.
3, with the testing, 3 months is usually the mark.
The mark
is that we can see improvement. That involves with the regeneration of sperm, time for supplements to kick in. That's always the 3 month is the period to see the effects of your work. So I always tell the guys that come in, I'm just like, do it once a month because it's kind of fun to see.
Exactly.
And it's motivating. And
it keeps them motivated.
It does. It really does. It's like with weight loss. When you track it, it motivates you to keep going, to do more and do better with it.
Yeah. Yeah. That's actually one of the things we're going to bring up. I know this isn't a truth or false, but wait, a lot of people will say you'll have to ask them their weight because for anesthesia.
Yes.
And they will give you a false number. And that's really important to tell the truth to your medical team, whether it's if you smoke or not, or how many drinks you have a week. or your weight. Like, just be honest with your medical team for everything. So a lot of times they'll say, and I'm on the calls with the doctors, and I'll be on with Dr. Victory, and I'll know the girl will be like, I'm trying to quit smoking. I'm down to like 5 cigarettes a day or whatever it might be.
Yep.
And I'm like, okay, we got to get that to 0 before we even start IVF, and we need to like get your body back, right? And the doctor will ask, and she's like, no, I don't smoke. And I'm like, be truthful with them, right? And now I'm not going to break your confidence, but you need to be truthful with them, because they're basing the medications on your weight. They're basing your dosing. They're basing the results. They're doing your whole plan on all the stuff you're telling them. So if they don't know the truth,
right. You have to be truthful with your healthcare provider. With like patient weight, BMI is a big thing.
It's a
with fertility
thing,
in the OR,
but a big thing.
100% it is. And we have a support system to try and help with it.
Yeah.
But the biggest thing is the safety, for example, retrieval.
Yeah.
I'm pretty sure regulations, we can't provide surgery over
40.
We can't do in the clinic a conscious sedation over 40.
38 or 40.
Over 40. 40 is the cutoff. Dr. Victory would like it lower, because there's so many risks with it for your health in having conscious sedation.
Exactly.
That we don't want to put anybody at risk. It does affect egg quality. It affects your recovery. And then leading into a pregnancy.
Yeah.
Like, it's just where the outcome for mom and baby.
Yeah.
And we want
healthy mamas,
healthy mama, healthy baby. Yes.
Yeah, exactly. And a healthy pregnancy, because the pregnancy, when they've gone through infertility, the fear of losing that baby is so amplified.
Yeah.
And we want you to be the healthiest so you can get through that pregnancy gracefully.
Exactly.
Yeah.
And weight is a very sensitive topic for some.
And
but we like to, again, be honest, be transparent, talk about your weight, but we're going to help you with it. We're not just going to turn you away.
Exactly.
We're going to help you. There are options. I tell everybody, there are options.
Yeah. On our meal plan that we give the girls weekly, people look at it and like, there's so much food, but we always do the breakfast and then a snack and a dinner and a lunch and a snack and a dinner and a snack to keep their glucose balanced throughout the day. And then they can fast overnight. Right. Yep. And they're like, it's so much food. I'm like, you will lose weight. And I remember a girl, she's like, oh, I don't know if I need the menu, because I just joined this place. It's my 2nd month and I've lost 3 pounds, but it's like $1,500 a month or something crazy. Oh my goodness. And I go, can you put it on hold and just try my meal plan, because people lose weight? And she's like, I don't know, because this place specializes in it. Her calories were so low that there's no way. And I'm like, you need healthy fats for a pregnancy. You need the right nutrients. It's not just about fat loss. We need muscle. We need healthy fat. So she tried it and she did. She lost like so much in 3 months. She's like, oh my God, that was like way better than the other ones.
It is amazing when you kind of.
Yeah. But when you're eating real whole foods and healthy foods, right? So it's best to actually just work with your team, give us honest numbers.
Yeah. And it's great because you have like the group of you, like you're all together. Like you remember you showing me pictures of everybody's breakfast. And I'm like, geez, I want this.
In the fight club.
You have that support.
Yeah. The girls
with everyone.
share their menus or their meals and their whatever they're doing.
Yeah. I think support groups are a big thing. Like what you have is you can talk about those fears and then the things that we kind of hide. We don't want to say anything.
Absolutely.
For your meal plan, I'm sure there's somebody that's just like, oh, I can't. And I had a chocolate bar last night. And then they'd probably hear from everybody else. Oh, I have no, don't worry about it. And that's what you need.
That's what
you need somebody else to know because they're feeling the same.
You're going through fertility, but you're human. And that's what, exactly. What do people stress about with IVF that doesn't matter? Like, I feel like they stress about the numbers of follicles a lot.
I do get a lot of, they stress about the follicle size.
Yeah. The size.
The timing of appointments.
Yeah.
They think they've missed it, or like when the trigger is they think the ovulation, that I'm like, no, they've missed it, but they're forgetting that we're controlling. They're not going to ovulate.
Yeah, they do. There's a lot, like the little things. And now with Chat GPT,
Oh, I know.
As soon as they get their stim sheets, they're putting them into Chat GPT, and I'm like, you what?
Yes.
And I'm like, stop putting your files in there for one.
Yeah. There's always lots of little things. I guess I try when somebody like has a question. It's, you know, when we think like, oh, it's nothing. But I'm just trying to, I put myself in their position.
Yeah.
And to them, this is real.
That's
this
the
is a
real
big
thing.
stress. So it's like,
Yeah.
again, who am I to say that? No, I have to validate.
You have to, because
always. Otherwise, it's not going to solve the problem. It's just going to make them think.
Spin out more.
My nurse doesn't care.
Yes.
They don't care. They're not listening to me. And that's
Yeah.
the trust.
The trust.
Yeah. We lose the trust. So there's some things for sure that aren't really much of a concern, but
yeah, we talk about them so they know.
yes.
Yeah.
We try to. So that may be the times where I'm like, Crystal.
Yeah. And there's a lot of like little questions that they think may be a bigger problem. And I'm trying to think, it's a lot of times the numbers. Yeah.
For sure.
Yeah. And it could be, sometimes you just have an off cycle, and I'll say, let's look at it. And I'm pretty sure with BRC, the first like even 6 days of monitoring, if things aren't going well, I think you can stop it and hold it. And I think it's not expensive. Like
the biggest thing when we see the first scan, if something slightly looks off, we talk about it and just say your options are we fully stop and we wait, or let's give it 4 days of meds
and see let's
see what happens.
Yeah.
Because sometimes you keep going and everything clears up.
Everything's clear. Yeah.
Yes.
Yeah.
But I also review, okay, you're going to be taking 4 days of meds. If you don't have drug coverage, like, are you okay with this?
Yeah.
We kind of go over that, but 9 times out of 10, patients will, let's just see what happens.
Yeah.
To keep going.
Nobody wants to stop because they want to accelerate.
I know. Correlation from E2 to follicle sizes, depending on what cycle you're doing, like luteal, follicular, that can be different. And it's always concerning. Like that gets patients, they're worried. Yes.
They're freaking out.
Yes.
Yeah, for sure. So those are some. I love this one. Okay. Why is it a bad idea to test right after transfer?
The home tests can be inaccurate to start.
Yes.
If you have an HCG wash done at transfer, you're going to get a false positive. It's going to show still in your urine for a few days. Yes.
And people get excited.
They do. And I've had patients even take home tests and they're negative and they come in and it's positive, the blood test. So home tests are not reliable. I feel they stress you because I get emails of pictures.
Me too.
A dozen tests that they're peeing multiple times a day. And they're like, well, is it darker? Is it not?
Is it darker?
Is this? And I'm like, I don't know.
I know. And then you're blowing up the phone. And I'm like, I'm down the rabbit hole now.
Well, they're just going. Yeah. I'm like, just pee away that money.
Yeah. Exactly.
For sure. I'm kind of one. I would be one. The day I'm going to go in for my 2-week check, I would test at home because I want to prepare myself.
Yes.
That's just my own. So I understand that one, but the testing day 7 and wanting to go and along that line
3 or 4 times.
Yeah. And then they really want a blood test like early. And I keep advising, don't do it. No. Don't do it. So then I'll cave. I feel guilty and I'll let them test day 10 and it's low. Naturally, because the HC hasn't had time to grow. So then it freaks them and puts them into more stress. And I'm like, I have to hold strong. I tell them 14, day 14. Yeah. But it's snowballs.
That goes hand in hand with the early ultrasound too. Because if you have a positive and your beta is looking good and you push, because usually the girls will push for an early ultrasound.
Yep.
What happens is if they can't hear that heartbeat, that is a gut punch that I've had, and you have to come back a week later.
Yeah. It's and you don't know
early you're living with that
to see everything, to determine if it's a viable pregnancy. Horrible. And then same with like multiple blood tests of HCG. Yeah. Your HCG rises, but it does start to plateau. Like it doesn't keep raising by 66%. No. So and then unless you're tracking it, and then if you go on different machines, like you're going to get some variations.
Different people from taking the blood work.
Yeah. Exactly. Yeah. So I always say there's a reason why, like, just trust the process.
Yeah.
So trust the process. Yes.
Absolutely. Okay. So those are really good ones, because those are things that I think always come up. What are things that people are too embarrassed to ask? So some of the ones that I have are, when's the last time? Well, not embarrassed, but I guess, because they wouldn't ask you necessarily, but can they have sex right after the transfer? Is it going to knock out the embryo? when is the last time they can have sex before the trigger, what's happening and what can they do? Because they always want to know that.
I that for sure. I get asked that, and it goes along with your sperm quality.
Yeah.
You need to ejaculate. So have sex.
It's not going to
connect with your partner. Have fun.
Yeah.
You know, it's the big thing is the connection. Before IVF, we want to make sure we time it that you stop 2 to 3 days before, because we don't want to empty the tank the day before. Like we want to have a decent,
trigger,
but
right?
I don't want a trigger. So 2 days. I don't want like 2 weeks of a tank. Like,
no.
I want to keep filtering out. Transfer. Dr. Victory does recommend having sex before the transfer. The sperm, like, just it helps
and
with
then
the lining
I will
and receptivity.
Always get told, well, then we won't know if it was the embryo or the. I'm like, doesn't matter. You're pregnant. Let's go for it.
Yes, and that's we also remind, we controlled your cycle. We didn't let an egg fall down. Yes,
that's true. Yeah. That's true. Yeah, but I get told that all the time. Yeah. And then around retrieval, though, I will say, you have to be careful, because if you have a lot of eggs, you could be tender, and we don't want your ovaries to twist.
Yeah.
Right?
So afterwards, we just say wait until after your first period.
Yeah.
Because you are going to be uncomfortable if you depending on where we had to retrieve from, that sort of thing. We don't want to increase any risk for infection. Yeah. So just no baths.
That part is Yeah.
Can
they have a glass of wine after transfer?
No. We have to treat you are pregnant. Yes. We treat it like your transfer pregnant. Like you're pregnant. So that even goes along with, I get patients that will email asking about medications. And I always say, check with the pharmacist, tell everybody, I might be pregnant. So we have to treat it like I'm pregnant. If you happen to go into Emerge for you're sick, you have to tell them, because they need to give you medications that are safe for pregnancy. And same with testing, like testing that's safe during pregnancy. So you have to treat yourself, and pharmacies know the best with medication.
Yes.
Or they should.
They should. Yes. What if I miss some of my progesterone?
Depends.
It depends.
So I always say, if you're going to miss one, don't miss the progesterone oil. Progesterone oil keeps that steady level. The vaginal is supplemental to kind of keep a better balance. So if you're going to have a nap and forget one, try not to forget the progesterone oil.
That's right.
Yes.
Yeah.
But ideally, for best chance, you need to do both. Yes.
I do. I find that a lot of people call me panicking because they've missed a dose. So not really the PIO, but
the vaginal one, it's 3 times a day. So 100% I get that a lot.
Hard. Yeah.
I feel like nobody forgets the injection, because
it's a mindset thing.
Yeah. That's not a forgettable thing.
No. Exactly.
The girls remember those injections.
Exactly. What if they accidentally take the medications at the wrong time? And I guess that's going to depend on what medication.
It'll depend what it is, for sure. If you took your stim meds, and when I say stim, that's like your Gonalef, Menopur, Recabel, that sort of thing. If you took it an hour before, hour later, okay, I'm glad you took it. In general, Cetrotide or Orgalutran, that's a big one, because that one prevents ovulation. Yeah. If you miss that one or take it too late, you run the risk of your body trying to release an egg. Yeah. If we start releasing eggs, the cycle is done and we have to wait. So yes, it depends on what it is. If I get a message that they forgot to take their progesterone oil, they're supposed to take it at 5 p.m. and it's now 9 p.m. Oh my God. Just take it. Yeah. But then with the trigger shots, that's a big one. The trigger shots are very important.
I don't like getting those calls.
Yes, those are panicking. If I get emergency line calls that they forgot it, or they forgot to pick it up from the pharmacy.
Oh no. Yeah.
Yes.
No.
That's a big one. So that's a really hard one, trying to track that down.
Yeah. That's a hard one. Yeah, for sure. So many times I'll answer a call on like a Sunday, and you get like the most random questions. And I have like a little book, and I need to continue writing the book, because it's like the funniest stories and situations that happen. What's one funny situation that you had? And like, we're not laughing at anybody, but just sometimes these situations present itself in the fertility world that it's just so ridiculous. Yeah.
I think funny yet shocking. I had a case where the partner reached out and was like, "Okay, I'm going to be on vacation. When will I know when the transfer is? Because do I know when to produce my sample?" Because he thought that the eggs are just there until we want to, and then they go in. They throw the egg and the sperm, and they put that in. And I was like, "Oh,
well,
that's I fail you? Or was that again the health system failed you?
They did. It's like, yeah,
Yes.
we're going to do a high school tour and teach all the high school students
I
on
know.
what actually happens with fertility.
Yes.
Okay. This will be
Yes.
like a secondary podcast, everybody. One of my funniest stories was, I think I told you, I got this call and it was probably a Sunday and it was before the twins were born. So I had time on a Sunday to grab the phone, and she asked me if I would do something for her because she needed a medical professional. And I'm like, what kind of medical professional? She needed me to go pick up her husband's sperm from the jail and bring it to the fertility clinic so she could do an IUI. And I'm like, what?
Oh, yes.
Because they were moving her husband to Supermax. And she didn't know if she would be able to get it. And the nurse at the jail wouldn't give her the sperm. And none of the guards wanted to hold the sperm. And I'm like, oh, well, like not even that's above my pay grade.
Yeah.
I'm like bowing out respectfully.
Yeah.
And she was really pushy. And I was just like, oh man, girl, I cannot do this.
Yeah. We've got some other issues we should talk
There's
about.
some other issues. And like,
yes,
we need this sperm like tested.
That is why we have an ethics committee.
Ethics.
Because actually we have had a situation where the partner was incarcerated.
Yeah.
And it's like, oh, what do we do? Like,
what do you do?
Oh, that is why we have ethics.
Yeah. 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 So there's a lot of those things.
Yes.
So let's wrap up with one question. What do you think makes the girls that are successful from not successful? And I'm not talking about like genetics or anything about their egg reserve or anything like that. But what do the girls do? And I'm saying the girls because most of the girls are more involved, but the couples, what do they do that gives them a faster road to success than the ones that don't?
They follow the instructions.
Yes.
By their clinic.
Yeah.
They take the time to read emails.
They read the emails.
They understand, they ask the questions.
Yes.
So they understand.
Yeah.
But they follow the instructions.
Absolutely. Absolutely.
Mm-hmm.
There's been countless, as you say this, countless times I will say to you, so-and-so needs this from you. Do you have it? And you'll be like, Crystal, it's right on their email in bold, in capitals.
Yeah. I have to say,
then I'm like, am I copied on that email? Because half the time I get so many emails, I don't check them right away.
Oh, I am guilty. Like, I'll admit that. Like, one of my faults is I think I don't pay attention to detail sometimes.
Yeah.
But when you get a massive email with like paragraphs, and it's like, oh my goodness, I'm gonna miss something for sure. Exactly. So I try to, and that's why I try to keep my emails very basic, very to the point.
Yeah.
Highlight stuff, because anytime a patient's like, well, I didn't know that, then I'm like, that's my cue that I need to change how I do it to make exactly so everybody understands. So I pick that up with some, but definitely, which I know I'm good for, is like reading thoroughly and making sure like that AM PM thing.
Oh yes.
Yeah. Checking your next appointment, date and time, location of your appointment.
Location is important. Yeah. We get calls like that all the time.
For sure. If you have questions, just ask.
Absolutely. Yeah. Okay, so we're going to wrap it up. Lindsay, thank you so much for being here. Thank you, everybody, for listening to the Fertility Fight Club podcast. Stay tuned because Lindsay and I have a whole bunch of adventures. We're going to call them adventures.
Yes.
And we're going to be talking once a month about fertility and all the tips and tricks. And we're going to try things and we're going to tell you why they work, why they're effective, or why they don't work and why they're not effective, and what the science is saying. So everything from acupuncture to foods to NAD to the HBOT, like the hyperbaric oxygen chamber, which I'm a big fan of right now. We're going to say
the good, the bad, and the ugly.
And the ugly. So thank you again. Thank you, Lindsay, so much. And that's a wrap. Bye.